All right, good morning, good afternoon once more, depending on where you're joining us from. My name is Lavenda Ochieng. I'm a research assistant at the Africa Research and Impact Network. I welcome you all to today's review session. Before we start, just a request, make sure we all mute our microphones so that we can have a smooth session to the end. Thank you. So today's topic, we're going to discuss about innovative financing for climate health research in Africa, looking at the challenges and the opportunities. So we all know that over the past few decades, there's a wealth of research that has been done, and it has emerged that solidifies the undeniable connection between climate change and health, and the escalating threats that has been there towards human health. So recent studies and reports from the IPCC has elaborated more that there's a robust evidence that climate change is just not something that we're trying to think of. It's something that is present and is growing towards public health emergencies. The data that we have is already showing that climate change is contributing heavily to the increased mortality and morbidity in Africa, especially to the vulnerable population, that is the community who are contributing to the least when it comes to climate change. So when you're looking at the extreme weather events, the disease vectors, as well as the food and water insecurities, these things have combined effort, and they're really affecting the global heat, the global health in terms of improved heat, and even the vector-borne diseases that we're experiencing today. So according to the IPCC, the sixth report that was shown, it warns us that if nothing is done or if urgent actions are not put in place, this impact will intensify and disproportionately affect the world's most vulnerable population. So when you look at the current state of evidence, looking at what has been done in climate change, whatever we have and whatever we know, there's a disconnect, and especially in the financing sector. So the World Health estimate that around from 2020 to 2030, about 2,050 people will be affected. And despite that, when the research that has been done, despite that whatever has been known, little finance, or around 0.5% of the global finance, is what is directed towards protecting this human health. And this gap in funding is a critical challenge that has undermined but the ability to translate evidence into the actions that we really need to curb this thing. So when you look at the climate interventions, you look at the insufficient involvement of health sectors in climate policies, and even the complexity in linking health outcomes to the climate interventions. These all together, these discussions are the barriers that we really need to address so as to curb or come up with a solution that can protect, especially this vulnerable population. So a collaborative action is needed between researchers, policymakers, and even the funders, so as to identify opportunities and even align our actions with a set of evidence and ensure that health is prioritized in the climate action or climate strategies, and that the most vulnerable population that we're talking of here are protected. So in today's review session, we'll determine and examine the gaps and the challenges in the current funding mechanisms, and discuss how we can innovatively mobilize resources to curb or address these challenges. So our speaker today is Mr. Boukari. Maanzou is from Benin, is a qualified agronomist who has specialized in climate finance, project and program management, contract farming, agricultural value chain, climate smart agriculture, and even food security. He holds 4 degrees, 4 university degrees, and he has around 10 years of experience in project monitoring and program monitoring and management. So Mr. Boukari also is certified in business and entrepreneurship by the YALI, the Regional Leadership Center, CRL YALI, that is in Dakar. And he also is also specialized in project and program management with master Maastricht School of Management in Netherlands. He has also climate finance with Frankfurt School in Germany, and also renewable energies from the African Development Bank. He also has forest restoration, landscape restoration with the FAO in collaboration with the Yale University, and also structuring of peace and organization from the Wageningen University in Netherlands. So Mr. Boukari is a researcher and also the RN focal point, RN contact person in Benin. He also has one more thing that I left out is alumni of the Nairobi Summer School for Climate Justice implemented by the PACJA. So Mr. Boukari, I welcome you to take us through the presentation. Just as I said earlier, just make sure you mute your microphone so that you can have a smooth session. In case you have a question or comment, we will have a session at the end of this so that you can raise them. Thank you, and have a fantastic presentation. Mr. Boukari, please.
Thank you, Lavender, and thank you for this fantastic presentation of myself. Hello, everyone, and I'm happy to be here to present my project of research. So before starting, I want to I want to tell you that I'm from a French speaking country. So you will excuse me if sometime you didn't I lost word or you didn't understand what I'm saying, but I will try to do my best to be understood. Okay, so I'm going to share my screen, and so we can. Oh. Okay, thank you, Lavender, and for this. I don't know if you got me.
Yes, we can hear you. Just put your presentation in presentation mode. Your slides.
Okay.
Presentation mode.
Okay. Thank you. So I will. I'm going to start my presentation, and I was saying, dear all, I'm from a French-speaking country, so you will excuse me if sometimes I lost word, and but I will do my best to be understood. Okay, so today I'm going to do a presentation of my research project, and this research project is on innovative funding for climate health research and the opportunities and challenge in Africa. Concerning the outline of this presentation, I will start by the introduction, and after that, we will speak about the objective of this research, and after that, we will speak about the conceptual and the theoretical framework, and methodological framework, and the case study and the success and the example in Africa, and we will finish by the expected results.
Okay, Boukari, is it possible you put it in presentation mode kindly?
More? Okay.
I don't know.
I'm trying to do it.
Or we can just continue. There's no return.
Is it good now?
No, it's not, but we can just continue.
Okay. So for the introduction, we all know that climate change represents an increasing threat of public health in Africa, exacerbating and existing vulnerabilities and creating a new challenge for health systems. According to the Intergovernmental Panel on Climate Change, The impact of climate change on health in Africa is manifested by an increase in vector-borne disease, water shortage, and a deterioration of in food security, resulting in devastating consequences for vulnerability population. For example, the cholera outbreak in certain coastal region and malaria outbreak linked to climate variation highlight the interdependence between climate and health Transdisciplinary research, which connects the field of climate and health, is crucial for understanding their impact and developing a suitable solution. This approach allows for integration of knowledge from different disciplines to develop effective and sustainable strategies in the face of climate challenge. Despite these pressing needs, adequate and innovative funding for the research remains a major barrier in Africa. And a study by the Lancet in 2021 highlights that investment in climate and health research in Africa are still insufficient, often focusing on short-term projects and sector-specific research. Additionally, funding inequalities between African and developed countries persist, limiting the research and innovation capacity needed to address climate research challenge. There's funding gaps present a major challenge in implementing sustainable health solutions tailored to African realities. This research project aims to examine existing funding mechanisms, identify gaps in current funding, and propose innovative strategies to mobilize the necessary resources for climate and health in Africa. To achieve these objectives, the following research question will guide our analysis. So for the first research question, is what are the existing funding mechanisms, including traditional and international funding sources, including international funding sources available to support climate and health research in Africa. For the second research question, we will see what are the gaps and challenges associated with current funding, particularly regarding resource fragmentation, competition for funds, and administrative barrier. For the third research question, we will see what emerging opportunities exist for innovative funding, such as crowdfunding and impact investing, and what role can multi-sectoral partnership play in improving climate health research funding. So concerning the objective of this research, the general objective of this study is to analyze existing funding mechanism for climate and health research in Africa, while identifying gaps and challenges in current funding and exploring innovative strategies to mobilize the necessary resources. More especially, the study aims to analyze the available funding mechanism to support climate and health research in Africa, examining the scope, accessibility, and impact. For the second of the specific objective of this research, we will access the gap and challenges encountered encountered in current funding. And for the first question, we will explore opportunities for innovating funding to improve climate health research funding. So we will start the, yes,
sorry.
Can you, yes?
We can't, no, it's not moving from our side.
Okay. And now it's, is it good now?
Where are you? Which slide are
Yes,
you in?
I'm going to start the conceptual and theoretical framework.
All right, that's fine.
Can I continue,
so just ensure you move the slide. Just ensure you move them. Just ensure you move with the slides.
Okay. Lavender, if I place this in full screen, I have some network work issues, and it will not change the slide. That's why I didn't put it in full screen.
I can help in sharing as well.
Okay, so I'm going to stop sharing my screen.
Is that okay?
Yes, it's okay.
All right, continue.
Okay, so we will continue with the conceptual and theoretical framework, and we will start with telling what is innovative financing, and after we'll see what is climate health research. Innovative financing refers to non-traditional method and mechanism for mobilizing financial resources to support projects and initiatives, particularly in the areas of sustainable development and research. And Half and Talwa in 2016 defined innovative financing as strategies that go beyond traditional funding to include creative approach such as crowdfunding, social and impact bond, and public-private partnerships. Regarding climate health research, it examines the interaction between climate change and health outcomes, highlighting how environmental disruption affect population health. Fromkin in 2016 defines climate health research as the study of the links between climate and human health, addressing the direct and indirect effects of environmental change on disease, nutrition, and well-being. Okay. For this research, we will rely on two theories. The first theory is the theory of innovation, in financing, and the second is the transdisciplinary research approaches. Okay. For the first theory, innovation in research financing is crucial for addressing the complex challenge of climate change and health. The theory of innovation in financing focuses on emerging of novel financial models designed by mobilize resources more effectively. For example, social impact investment and crowdfunding are emerging models that attract private funds and involve communities in the research process. Concerning transdisciplinary research, it is defined by collaboration between the different disciplines to solve complex problems, and is particularly relevant in the context of climate health research. According to Lang and al. In 2012, this approach brings together varied expertise and foster a holistic understanding of issues, which is crucial for developing solutions suited to African realities. So we will use these two theory in our research project. Concerning the methodological framework, we have a data collection method, and this data collection method is a mixed method approach. Using a mixed method approach is essential to ensure a comprehensive understanding of funding mechanism in climate health research in Africa. This method combines both quantitative and qualitative data, providing a complete picture of the opportunities and challenge associated with funding. According Creswell and Plano Clark in 2011, a mixed method approach allows for data triangulation, enhancing the validity and reliability of the results. So this mixed approach will use document analysis, case studies, and also interviews. Concerning the data analysis, we will use a qualitative analysis. First, we will use a qualitative analysis and a quantitative analysis. For the qualitative analysis will be crucial for deepening our understanding of funding mechanisms and their interaction within the context of climate health research in Africa. This analysis will be conducted in several stages using appropriate tools like identification of the emerging terms, relationship between different funding mechanisms, and also validation of results. Concerning the quantitative analysis, the quantitative analysis will complement the qualitative analysis by providing numerical data on funding mechanism and their impact. This stage will involve several tools and techniques like statistical evaluation of funding sources, project impact, and also synthesis of results. Concerning the case studies and success in the example, for the first example, we can work on public-private partnership to analyze successful project funded by public-private partnership in Africa, and we will select relevant initiatives that illustrate significant outcome for climate health. This process will include project identification, selection criteria, and data collection. For a second example, we will work on crowdfunding, and in this session, we will examine crowdfunding projects that have had a positive impact on communities in community health in response of climate change. And the approach will include project selection, fundraising methods, and community engagement. So the expertise results of our research project, we have for the expected result, we have three expected results. And the first is the identification and mapping of funding mechanisms. And so this study will provide a detailed map of existing funding mechanism for climate health research in Africa, identifying traditional and international sources, as well as the accessibility and the impact. For the second expected result, we will have an analysis of gaps and challenge in fundings, and the analysis will highlight major gaps and challenge in current funding, such as resource fragmentation, competition for funds, and administrative barrier, while offering recommendation to overcome these issues. And for the third expected result, we will have recommendation for innovative funding strategies. So this study will propose innovative funding strategy, including crowdfunding and multi-sector partnership to mobilize additional research for climate health research in Africa. So this is what I wanted to share with you for this session. Thank you for your kind attention.
Thank you, Boukari. Can you hear me? Okay. Thank you,
yes,
Boukari, for that brief presentation. That's more of a proposal. It's a proposal, actually. I think it's well elaborate and very direct on whatever you're working on is well understood and is self-explanatory as well. So I'll welcome anyone who has a question or a comment on that, just to feel free and critique it. It can be a positive critique or a negative one as well. So the floor is open for anyone. I hope you are all listening. And Boukari, one more thing that I may ask, I know it's relevant. You've talked of the expected output. One thing that we really know as researchers, that we really do a lot of work, but we keep our findings with ourselves. No one knows them, or even the people who know them or who are aware of whatever is done. The same way I talked of the state of evidence, whatever we know and whatever is being done, there's a very big gap. So how are you planning to disseminate your findings so that even the policymakers or even the funders know where to direct their funds to?
Okay. So do I have to reply, or I can take the note of all the questions, and after that I can reply?
I think maybe we can just get some more so that you reply at all of them at once. Agave, I'll welcome you just to give us a brief overview on how you think this proposal is. Yeah, welcome.
Okay.
Yeah, thank you, Lavender, for inviting me. I think the proposal, the way he has structured, I think he has really arranged it well by bringing out the problem, what exists. And basically, he wants to look at a research angle whereby most research within the climate change and health, of course, when we are talking about funding, we look at the traditional maybe funding, like we are looking at the major global funding agencies and how they are funding climate change and health. But now he has somehow also looked at, he wants to look at now the innovative, the non-traditional ways in which we can be able to source for funding to support adaptation and resilience efforts, especially within health sector and in Africa, where most of our communities are vulnerable to climate change. The methodology was okay, the way he brought it out and where he intends to get this information, whereby he really wants to look at to apply the mixed method approach, where he will engage both the stakeholders in this particular field and also look at what is available in documents. Maybe what he could have brought out is maybe which stakeholders does he intend to approach or engage to address those or to answer the research questions that he intends to maybe fill by doing this research. And then when it comes to documents, which documents or which websites do you think you will be able to get these particular documents, to get this information? That is also very critical. And then how you will analyze your data, and then the expected outputs really could have come out well to rhyme the objectives of the research. But basically, the research, if done, then it could be a good, really, it will have good findings that will inform policy and will also inform decision making. And also it will be very crucial even as we plan to we as people are preparing, organizations are preparing, almost the whole world is preparing for COP29. I think these findings will be very crucial towards that particular international gathering that is expected to be there in November. Otherwise, this will be a good study, and we expect to get more from you when you do this research and get your findings. We shall be happy also to interact with you just to find out what you got, what is existing, and from there we can see what to do next. Thank you very much.
Okay, thank you.
Thanks, Ageri, for that remark as well. And Edna? Now, do you have something to say? Kindly mute. Edna, go ahead.
Okay. Thank you, Lavender, for this opportunity, and thank you, Boukari, for your presentation. Mine is not a question, but an encouraging comment. I think his research comes at a time when we have been looking at climate change and health separately for a long time. But at the moment, a lot of research is being done in the nexus of climate change and health. So it is really a good thing that already he is thinking outside the box and thinking at more broader topics like financing in the sense of in the nexus of climate change and health. And I think it is also important because if you look at the previous COP, the last 2 years, climate finance has been at the central of those discussions. So it is also an emerging field kind of to say, especially when now we are focusing on health impacts of climate change and how climate change affects different health systems. So my point is, I think this is really an insightful study, and I'm sure the outcomes will really contribute to a lot of knowledge generation and knowledge sharing that is important for all researchers working in this space. So that's mine from my end. Thank you.
Thank you, Edna, for that.
Thank you.
All right. Thanks, Edna, as well. Florence?
Thank you very much, Lavender. And thank you also for the presenter. I think mine is not a question as such, and maybe also just to make a remark about the proposal. Because I think Africa now must be more alive to the broader implications of climate change, not only for public health, but for critical sectors as well. Because the IPCC has clarified very well that Africa is on the front line of climate change impacts. And this includes incidences of diseases such as malaria and rising cases of water scarcity and insecurity, just to mention a few. And these are going to affect the most vulnerable populations. And therefore, it's important for us to come up with innovative ways on how to address these challenges. One thing that I had the presenter mention is that he will work with stakeholders, and I think this is very critical, and especially it is in line with what we advocate at the Africa Research and Impact Network when we talk about transdisciplinary research being a cornerstone in addressing complex climate health challenges. And this is also because we recognize that integrating climate and health expertise is very crucial and of course essential for developing sustainable strategies that are context specific and also effective. So I think that is a very important aspect on his methodology. In terms of funding, I think significant barriers actually exist, and it's important for us to come with innovative ways of raising funds to address climate health research. Because the Lancet Countdown and other studies, including our very own at ARIN, have emphasized the persistent funding disparities that exist between Africa and more developed regions. These disparities, as we've learned, they are characterized by short-term projects with a narrow sectoral focus. And this actually limits the capacity to drive the research and innovation necessary to tackle these challenges that are posed by climate change. So I think his idea of coming up with innovative solutions of raising funds comes at a very opportune moment. The other thing now I wanted also to mention, because now when we talk about funds, I think this is something that ARIN has really recognized that is affecting research. And this is actually in line with our recognition that research is really impeded by lack of finance. And in recognition of this, we have launched the mini grants, the mini grants program, and this is actually aimed at supporting research. So I think his proposal comes at the right time, and I think this is a discussion that we should continue with just beyond the platform. Thank you.
Thank you, Florence.
They're really insightful. I don't know if someone has a question. Meanwhile, before we get more comments, you may consider addressing the few questions that had been asked earlier. That is the method of dissemination, the analysis, that how you conduct the analysis, and even the type of stakeholders that you will involve in your study.
Okay. So before doing that, I would like to thank everyone who overall appreciated the topic and provided into account to improve the project before beginning the research. So to disseminate our research effectively within community, and we will firstly publish this research in academic journal, and by submitting our finding to peer review that focus on climate, health, and funding mechanism. And after that, we will share our research at national and international conferences related to climate science, public health, and fundings. Also, we will collaborate with, if we have the opportunity, I will partner with research institution and also NGOs or university working on similar issues. And also I will use social media platforms to share the key insights, and I will updates from my research. So that's what I can do to well disseminate the results of this research. But if you have other recommendation, I can take it in my account.
Okay, that's fine. Also, maybe looking at social media, maybe you might consider doing an op-ed or even an open letter to the relevant policy makers and tagging them so that they might be aware of your findings as well. Right. So I really don't know if there's someone else with a question. Selau, you had unmuted. I don't know if you have a question or a comment, or it was a mistake. Let me assume it was a mistake. So I'll welcome the last one, probably Jim, just to give you a brief overview of the proposal. Then we can give the closing remark and call it a day. Jim, please. Jim is in the call. It's not here, probably. He's here. Jim, can you hear us? Okay, Charles. Charles. In case you're talking, just maybe muted feel free to unmute. Okay, I think they might be having their own issues. I'll welcome Ageve once more. Dr. Ageve, kindly give us a closing remark and some take-home messages as we end this meeting for today.
Thank you very much, Lavenda. And I think the way people have, the participants of this Friday review have given comments, there is a lot of interest when it comes to research, when it comes to interest within the climate change and health, and especially in Africa. And that is why now most people are really researching to find out the gaps and how we can be able to solve these issues by ourselves. And when you look at it clearly, most of the diseases we are facing or we are currently experiencing are coming as a result of climate change, as we have seen, the vector-borne diseases, the waterborne diseases, deterioration in food security. All these are issues that, if not really addressed, then we are going to experience maybe a devastating condition on Earth and also within the global South, where the effects of climate change are high. And in addition to that, initially the research in this particular area used to be just being addressed within disciplines, just if it is climate change or if it is the aspect of health. But it is until recently that the aspect of transdisciplinarity came into place, and that is where the interest is quite high. And this research also that today's presenter has made actually clearly rhymes well with what AREN is organizing. That is the fourth annual international conference on climate and health. And when you look at the third thematic area of the conference, it is on the aspect of strengthening funding opportunities for transdisciplinary climate and health research impact and impact in Africa. So it is quite timely that we look forward if by then you will have something tangible, maybe in November to present. You can maybe present the preliminary findings of what you have gotten from this research. We shall be happy to hear from you even during that particular conference. And as such, also, the way you have said, dissemination mechanism of your findings will be very critical in informing evidence, and especially when it comes to the funding gaps. How can we inform the developing countries who have most of the time been depending on the developed countries for funding, that you can inform and provide an evidence that we can still go for the innovative financial systems, which somehow, yes, they are sustainable as compared maybe to some of the traditional ones that always have some strings attached when we are getting such funding. So it is important that we continue having such discussions so that we can be able to come up with tangible solutions within the field of climate change and health in Africa. Thank you very much.
Thank you again. Thank you again for that strong closing remark. I want to take this opportunity to thank everyone, who made it to today's review. Your attendance is appreciated, and those who gave comments, your comments have been appreciated and also taken note of. So few announcements. I think the same people were here are the same who were there last week, but let me just say them. AREN is launching a capture platform that is a climate change and health platform that will, this is a platform that will bring together all the stakeholders involved in climate change work, climate change and health work, and also to share ideas, just like the fellowship brings together researchers, the Capture platform will bring together everyone working the climate and health platform. So welcome to this launch. It will be on 28th of August. That is, I think, next week, but one. Most of you, I'm sure, have received an email asking you to register. Kindly do so. Also, we're having the Llama launch. The date will be communicated appropriately, but within by the relevant team. Also, for the ARIN conference that is coming in November, we will love to welcome all of you. There's a call for abstract, especially those who are working on climate change and health, like Boukari here. Feel free to send abstracts there so that you can be given a slot for presenting this, and also use that as a mode of disseminating your findings to most people out there. So thank you so much for this day. I welcome Nancy to help us take the last group photo. So kindly turn on your cameras wherever you are, so that Nancy, you take us the last photo. When you're ready, let us know. Thanks, Fiona. Thanks, Gogo. Florence, I can't see you. I need to see all of you here.
There's a problem with my camera, Lavender.
That's a lie.
No,
Thanks
no.
again. Nancy, when you're ready, kindly let us know. And you can smile as well. Okay, your camera is off. Jerry, kindly let's turn on our cameras and give a broad smile. Nancy, when you're ready, let us know kindly. Nancy.
She has said done.
All right. Thanks, everyone. Have a fantastic weekend ahead, and let's touch base next time. Bye.
Nice weekend.
Bye bye.